pleasure for me to be able to come and join you and being able to provide you some results of the project that we initiated in the Northumberland County. And maybe we'll go to the next slide, and then we'll be able to provide you some context in the project. So our project was funded by Healthy Seniors Pilot Project in October 2019. And we all know what happened in 2020. So due to the pandemic, the scope of the project as well as the timelines of the project were really changed in what it was supposed to be doing. But the decision was made that it was so important to us that we still went through with the project itself. So it was implemented and in the Miramichi unit in June 2022. There were two types of results or findings that was measured. There were the qualitative findings of the needs assessment and the experiences of various participants. So the qualitative findings were for the patients that participated in the project, the extramural program clinicians, the folks who did the role of the case managers. We had review board, and I'll talk to you about that structure that we established, as well as members of the management teams that included EMP, but also included some other partners around the table as well. There were also some quantitative results in terms of patient quality of life, their satisfaction with the services that were offered. And we also measured that quantitative results with the clinicians as well. And this is where we measured the impact on the reduction of ED visits as well as hospital admissions. We can go to the next slide. So before I get into what we meant by case management, there were two elements that we were able to, with the timeline that we had, that we were able to demonstrate in the context of this initiative. One was case management itself and what happened to patient care when we had a case manager specifically assigned to their follow-up and care. And what the other aspect measured was, what if we had a community paramedic that was also part of the care team, and how was that role going to really help support the target population? So I wanted to take a moment to talk about case management and what we mean by that, and because there's all types of interpretation on what that could mean. So for the sake of this project, it's a person-centered process for quality health and social services through effective collaborative planning and navigation of the services for resources and supports. It's a role that really guides the patient in ensuring that they have the clinical needs, but also the social needs that are required in order for them to really have the optimal care that they require. It's a role that really ensures that people have safe care, that the goals are realistic, and it's really aligned with what their goals are as well. And it does focus and concentrate on people with complex health and living in a social environment that where there's complexity in it. The common attributes that were applied in this project specifically is that it's a service that's accessed by one way of accessing the service. So it's single point of entry. It's very uniquely targeted to some types of patients, and I'll talk to you about the definition of the target population in a minute. And it's the population target that really would best benefit from case management. It means that there's a comprehensive assessment of the patient's risks and needs. It's coordinating of care, obviously. It's individualized care planning, meaning that every individual has different needs, so the care plan is individualized for their needs. The case managers are specifically trained to do this work, and the case managers work with multidisciplinary members of the teams that is beyond just extramural program, but also the other partners in the community. It supports our clients managing their own care as well. And it's there to ensure that there's a smooth transition across all of the sectors that are really offering a service to this patient as well, patient, client, or and it's also linked with effective health information management, which means that it hopefully supports a way by which we're able to communicate in an effective way and a seamless way. Next slide. So this here is the diagram of how we set up this case management model to be able to do this work. So as you can see in the top, you'll see that we have the patient who is in green, and the partners that we had around the table were Ability New Brunswick, Addictions and Mental Health, Ambulance New Brunswick, Community Health Centers, EMP at the center, because EMP were those that took the lead with case management. We had First Nations, as in the Northumberland County, there are 3 First Nations communities, hospital partners, social development, and others as required. And at EMP, we have a care coordination center, and that is where all of the requests for services come through. So our care coordination center became the place where the requests for services for these types of clienteles were actually vetted through. So it really, it was there to really help with, with any patient that had multiple providers, that had lots of appointments to be able to coordinate, that had complex care issues, which made it difficult for them to navigate the system. So this approach brings together all of these partners in a coordinated manner to be able to have the best possible care plan for the patient. The target population were people 55 years of age and over that had 3 or more chronic conditions, had 3 or more ER visits in 2020, and we excluded those that had end-of-life care patients. Obviously, the approach is successful if it considers all the core determinants of health. So for that reason, there were holistic assessments that were conducted to ensure that it addressed all the core determinants of health. Next slide, we'll talk about how we organized the flow of this information. So in the process, we had to identify the patient. And the patient was identified by our partners, by the hospital that provided us information on the high utilization at Emerge, by primary care providers, by EMP, or by other stakeholders. And I have to say that that became something that was a little bit more difficult to just find the right population. Once we found the patient, it was referred to the Care Coordination Center. When it met the criteria, it was assigned to the case manager in the Miramichi unit. We've had a review board that met on a weekly basis that had membership from all of the partners around the table. And as we received a new case or a new patient, this is where the care coordination started to ensure that there was good care that was wrapped around the patient. And this is where we developed a shared care plan for the patient themselves. Next slide. Thank you. So when we looked at the number, we had a total of 98 patients that were case managed. Of those, there were 33 that were from First Nations communities, and 65 of them were existing EMP patients that lived off the First Nation, externally to the First Nation communities. And just to give you a bit of a profile, so majority were retired, married, or in common law relationships. Some lived alone, had a high school or general equivalency diploma, rated physical health as fair, could perform most but not all activities of daily living without assistance. So it really was a wide range of patients that we did receive. The average time of care coordination that they were under the care was 3.5 months for First Nations and 5 months for the EMP team. There were 13 First Nations patients who were living with very mild to severe frailty, because we did measure the frailty for all of our patients, while 8 of them were mild to severe for EMP patients. And some of the higher needs that were identified were in areas of mobility, caregiving services that they required. They required support to access mental health. They required equipment to make sure they were able to stay safely home. They needed support for diabetes management. They needed support for advanced care planning as well, for medication management, and also to navigate the system to access more financial resources. Next one. Oh, I think one one, if we can go back. Oh, there we go. One more, I think. One more. Perfect. So when we look at the qualitative findings from a patient's perspective, there were 105 interviews that were conducted with both patients and our staff as well. So for the case management perspective, which meant the case manager itself, overall, the experience by the patients were extremely positive. And if you have a chance to look at the report, the comments were so very positive. I mean, we had some that used to go to Emerge quite a bit because they really didn't know where to go and really relied on the case manager to help them finally connect the dots with their care plan. And that really came across loud and clear. They felt that their support was individualized, that was tailored to their needs, and with continuous support. So it came through also loud and clear that they could access their case manager anytime, and some of them did, and they were available when they required them. And they really appreciated the easy and direct communication that was offered by the case manager itself. And for them, they categorized it as invaluable support that supported both their health and social needs that impacted their lives and health. So it was really for them described as a lifesaver because they were really lost in the health system and didn't really know where to go after. And then the role of a community paramedicine is for us in New Brunswick, that was the very first time that we had such a role that we demonstrated. So we're quite excited to do that. The community paramedic is from Ambulance New Brunswick, but worked very collaboratively with extramural program. And the satisfaction rate with this role was extremely high as well. They felt safe. They did the physical checkup. They had a list of patients that needed just more support and more check-ins. And they visited them on a regular basis to offer reassurance, make sure that they were comfortable. So they offered some clinical support, but they also offered quite a bit of social support as well. And they identified having great trust in a paramedic coming into the home in their uniform. So as we all work with First Nation communities, we understand that trust with the current health system is difficult for them at times. So that came out loud and clear with First Nation communities especially, which is very positive by itself. Next one. From an EMP employee perspective, they are very proud to offer quality care. They experience a lot of support by colleagues. And I think like what we measured here was, their ability to be able to support case management or really what their life is like as an EMP employee within the world that we live in. And there's a lot of support between colleagues, but definitely a strained workload, a lot of initiatives. Staff shortages is really high, and there's still not an electronic documentation system in EMP, which is going to change by the end of this year, but that still produces a lot of strain on our staff. And although you'll see that with extramural program, there's very good care coordination within the team of EMP. It came out loud and clear that when you do true case management with other partners, it takes a lot more time if you do it really well. And it was clear that they wouldn't have had the time to do that within their existing workload and resources. When we looked at case managers themselves, community paramedics, members of the review board and managers, They all agree on the importance of case management to help decrease ER visits and hospitalization. The people who did the case management felt immense personal satisfaction as they observed the impact that they were having on people's lives. I want to remind everybody that this was done during the pandemic, so there was quite a bit of rollover with people stepping into those roles, both at the leadership of the initiative as well as with case management. So that was really difficult on the team itself. And there was some confusion with the clarity of the role and the case managers feeling that they had the appropriate training because, although with time it became clearer for them, it was hard for other people of the team to truly understand what their role was. Next. Next slide. Oh, there we go. And when we looked at the quantitative piece, again, the patient, what they really liked about case management is that they felt that they could candidly speak about their problems and the issues that they needed to address. They felt that the phone calls were returned in a timely manner. They felt treated with respect and dignity, which says a lot because, again, sometimes with First Nation communities, they don't always feel that respect. They felt that their feelings were considered and felt really involved with their care, which in my opinion is really important in any care plan that we describe and define for our patients. Again, for the community paramedics, safe and secure, they felt that they connected them to the health needs, to their own health needs. They felt secure knowing that they would visit on a regular basis. They felt cared for and they felt supported. They felt heard. And what was interesting was that they had improved knowledge about the services that they received, because sometimes they didn't always understand the types of services that they received. And then they felt that the advice that they were getting from the community paramedic was also very helpful to improve their health. Next. What was super exciting, of course, is, did we have an impact on ER visits and hospitalization? And when they looked at what they measured, it was the ER and hospitalized visits 12 months prior to enrollment, during the time they were followed by the case managers, and then 6 months after the project. And very excited to report that it was statistically significant reduction could be observed for the number of ER visits for the patients that we served, and it was the same for the hospital admissions. We had a specific case that was followed by the community paramedic that was visiting Emerge on a monthly basis that completely stopped going to Emerge once the community paramedic started to visit on a regular basis. So that, I think, says a lot for the reassurance that they felt. And the next one. So some great information that, I think we have to say that despite the COVID-19 related challenges during this project, patients ended up being very satisfied with both the case manager and the community paramedic service. We did see a significant impact on ER visits and hospital admissions. We acknowledged that there was a lack of policies and procedures, processes, training, and it was all related to having the resources, having to deploy them for the pandemic. But just the same, it's important that as we move forward, that we have some strong processes in place for the teams that are implementing this. And our clinicians would tell you that they really understand and see the importance of the role of this case manager. But it was clear that it's recognized that if you want to do this well, there's a time factor that you have to allocate to these resources to be able to do this, and that you do need this dedicated resource to be able to support those complex patients. So I'll stop there because this is really a high-level summary of the findings, but I will